Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board-certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun.
Hey guys, do I have the episode for you today? All about facial rejuvenation. And I brought on one of the best in the country, Dr. Kate O'Conner out of Tennessee, and we're going to go over all things facial plastic surgery. I'm so happy to have you on the show, Dr. O'Conner. Thank you for being here.
Thank you so much for bringing me on. This is literally my favorite thing in the world to talk about.
Girl, I love it. When you get two people who are so hyped about the same stuff.
Oh my God.
It's like,
we can't stop.
You can't stop. Sometimes I'm like, oh God, this recording has gone on for an hour and a half. We might have to cut some of this.
I know, right? That's the truth, honestly.
It really is. So it's really refreshing to have surgeons come on the show and be transparent and just tell us what you know. So one of the most popular procedures, especially now with, the buccal fat removal, with the cat eyes, with the brow lifts, is facial rejuvenation. So you guys know that I'm always going to tell you everything that I know, and I'm going to bring you the best that I can. And one of those things that I don't do is I don't follow trends. I don't think we should be following trends. Plastic surgery is customized to you and what your hopes are and what you're looking for. And trends are going to come and go, but classic never goes out of style. So Dr. Kate O'Conner is perfect for this because she's going to give us the best recommendations for somebody like me. Dr. O'Conner, I'm 33. I'm going to be 34 this year. And I'm starting to worry about my jowling, my under eyes. So I'm still at an age where I'm not ready for surgery. I'm not ready to have a facelift yet. So I want to talk about what treatment options do I have for facial rejuvenation, to keep a youthful face?
Absolutely. I mean, Mavi, first off, you took one of our favorite, tenets and principles is that trends only good for clothes, shoes, maybe bags. And even then, sometimes finding your own personal style pays dividends. And same thing with your face. I'm new to TikTok, but getting on there and just seeing the debate people have about, you mentioned buccal fat. People are talking as if it's just been around. There have been surgeons doing buccal fat removal and fat grafting that area since the 90s. But it's just funny how you see kind of the cyclical things come back when the answer is exactly like you said. Your face is not a trend, and finding someone that you trust and can have that long-term relationship to actually create treatment plans centered around you. I mean, that's always going to be where you feel your best, look your best, and kind of get the investment that you're hoping to recoup. And I love what you mentioned about kind of thinking of your age and your demographic, because that is something that we in the facial plastics world are seeing more and more. People are being really, really mindful of what aging is and what aging is for them. So kind of one of my other soapbox things is what does aging gracefully mean? And people can be anti-surgery and anti-treatments. But at the end of the day, to me, aging gracefully means you get to choose what that is for you.
That's beautiful. That's perfect.
Yeah, because, it's we're all up in each other's business anyways, thanks to social media and all of that. But it does look different for different people. And so we're facial rejuvenation could literally be someone's entire career. It's such a broad topic, but kind of working systematically, we kind of need to think of how the face ages and then address the things that changes. So first, what I really, really want your listeners to know is that your face ages in 3 dimensions. And finding someone who can articulate that to you lets you know that they're going to be paying attention to all those different things. So we all know kind of that our collagen drops off. We see that with skin laxity, little fine lines and wrinkles. We then get below the skin and see that the actual fat pads of our face change. And this ties back to how buccal fat removal, for some people, they're arguing for it, against it. We'll circle back there. But knowing that the face changes at the level of the skin, the fat pads, in which some areas they regress, other areas they grow. And then to the skeleton, our bones actually remodel and we lose some of the bone density, particularly in our cheeks and along our jawline. And so kind of bringing that together in the whole package, it was really helpful to me when I was like first starting out to imagine what we call the triangle of youth, in which like nice full brows and eyes, and you picture the fat part of the triangle up at the brows going down to the skinny part at the chin, also known as like a heart-shaped face, but not everyone has a heart-shaped face. So I like thinking of it as the triangle of youth, and then upside down, we get the reverse. Fuller along the jaw, everything kind of sags when you imagine the point of the triangle pointing up towards the brows and the fatter, thicker part along the jaw. So we have so many different things to address all those different layers.
And for my age group, what are you seeing the most common? So for me, jowling would be what my main concern is. Like, I don't want to have any jowling. What would be the recommendation for that?
So recommendation is, of course, you know me, I'm a purist. You have to talk to your surgeon.
Of course.
Because touching the skin, preaching to the choir, you know this, your really educated patient cohort know this, but I have to do my due diligence and say that. When I think of the jowls and someone who's not ready for surgery, two things come into play. One, addressing the skin, as I mentioned, because that's changed. We do that through lasers. Some of the newer radiofrequencing devices can be nice in this area, or replacing the lost volume, right? Because as we talked about, if the cheek pads have fallen a little bit flat, if the mid-face has gone in, sometimes using volume can help with that area. The other thing that I want to just mention, but not go too deep in, things like fillers and neurotoxins can be helpful, but I actually don't love them in the jowling area. The reason being, it's really hard to get that area right without making it look fuller. You know, you put the filler on one side and all of a sudden you have some lymphatic obstruction and you can actually make those jowls look worse. There are some really talented injectors who can get away with this, but for by and large, I think that the better things would be to kind of address what we talked about with the skin, with the fat, and with kind of like tone and texture.
I love that. So now that we're kind of on this, like, not touchy, but like subjects that there's a wide range of opinions on, I would love to get your opinion on thread lifts.
Yeah, absolutely. Girl, you're hitting me with the hard-hitting question.
I know.
So
let me tell you why I want to know what you think. So let me tell you guys, Dr. O'Conner also has trained with Dr. Giacano out of New York. And if y'all have seen me share his before and after pictures on my Instagram stories, you know why I'm asking. They're amazing. And I mean, I want to know, what is the consensus on threads?
Perfect. Well, I'll just come out of the gate and say they're not a part of my practice and they're not for me. The reason is twofold. As obviously you mentioned, training under Dr. Giacano, facelifting is something that he really has modernized and kind of brought into the 21st century. And it's an interesting tie-in because you mentioned that you're not ready for surgery, but oftentimes if some people have really, really deep nasolabial folds, the jowls, and just kind of their facial architecture, doing a facelift when you're young can be life-changing. You have enough collagen to bounce back a little bit faster. It can look more natural than some of the more quote unquote non-invasive things we do. So one of the things that like sometimes happens is sometimes doing more makes the appearance of doing less. So with that, when I think of a young person, thread lifts can be great for about 6 months and then they go away. And what's your trade-off during that time? It's increased cost. And each time we do something to the face, there's signs, whether we see it internal, external. I always tell my patients there's no such thing as a free lunch. We just got to know what our trade-offs are. So for thread lifts, it can generate scar tissue that if down the road you're interested in a facelift, it makes it harder for your surgeon to deal with that skin and some of the texture irregularities and that sort of thing.
On that, whenever you're opening up for a facelift, do you commonly find stuff like fillers that have not dissolved yet or not really? Because I've seen some pictures and I'm like, I don't know how that makes me feel.
Yeah, all the time. Filler, you see it. Imagine just kind of how it's looking in the syringe. The tissue gets a very kind of like jello-y substance and you can actually just suction it out. And that's quote unquote, dissolvable filler. As people, historically have used other types, Some of it is permanent, like silicone, and that needs to be cut out. It kind of like forms nodules and stuff like that if it's injected into the wrong plane. So great question. Absolutely. You can find filler. Even when people were like, oh, I had that done 3 years ago. It can sometimes still be there. Right?
Wow. That's amazing. That's really interesting because I stopped doing my lips. I'm giving my lips a little bit of a break. I had been doing filler on my lips for years. And I was deciding to like let it all kind of go away. And then I was going to start again. And even though the filler only lasts, or it says it lasts from like 9 to 12 months, right? Or like 6 to 12 months.
Exactly.
Even till now, I still have some in there from a couple years ago.
Isn't that wild?
It is. Yeah. It is. So also the reason why I'm very cautious and I've never had under eye filler. And I would love to hear your opinion on that.
Perfect. I actually have had under eye filler and I did not like it. I was a resident. I did it. Even now, I think I still see a pocket like in some light. So to what you said about the lip, it's kind of that same thing of like, holy cow, like, yep, there may be my little pocket of filler. Mm-hmm. So under eye filler, again, it's just like that skin is so thin. And we think about what kind of happens when you place filler. It draws in a lot of water, even if like they have cross-linked it, try to minimize that. And I think for some people, that's why they don't like how puffy it looks. It can cause lymphatic obstruction. Let's get those words out. Or like that Tyndall effect where you kind of see that blue-gray under the skin. For me, when I'm thinking under eye, surgery is obviously always in my back pocket. I'm a surgeon,
right.
Go with what you know. It's going to be the gold standard. But things like fat grafting, things like Nano Fat, things like PRP or PRF and lasers can be really, really nice to rejuvenate that area, keep it really soft without having to go to surgery and won't have that kind of just like filler, pillowy, puffy look.
Mm-hmm. Now that you touched on it, I think this would be the perfect point for us to talk about the Nano Fat grafting because I love Nano Fat. So I really want, let's go into it.
Let's do it.
So let's talk about Nano Fat grafting. What is it and what's the difference between Nano Fat and regular fat?
Yeah. So Nano Fat is kind of like a continuation or like a further refinement of fat grafting. So like your listeners and like you do such great work of bringing like the best of like the BBL surgeons to light and all of that. So we know about fat grafting, right? We can take fat, put it in different areas of the body to help replace volume. Those bigger clumps of fat are surrounded by like little stem cells, little pieces of our vascular system and like the supporting immune cells and growth factors that all add to the fat growth and help it stay and live where it is. Then early in the 2000s, someone figured out that if you take that fat and you process it through progressively smaller filters, you're left with just the stem cells, those vascular precursors, those immune cells, and those growth factors. So that's what the core of Nano Fat is. Nano Fat is really thin, almost like a PRP or a PRF. The difference is while PRP has a lot of growth factors, it's not really rich in stem cells, while Nano Fat is. So we know from looking at the cells under the microscope, it causes more collagen growth. And that leads to that like nice tone, texture changes, as well as decreasing some of the dark spots.
Beautiful. And I think let's tell our listeners real quick, what's the difference between PRP, which PRP, they draw your blood, we spin it in a little centrifuge and we get this gold liquid out, the plasma, and everything gets separated. We pull it out and that's what we use. With Nano Fat grafting, you do a little bit of fat grafting, like a regular, like fat grafting. And then you run it through the different filter systems. And then let's talk about PRF.
Perfectly said. So PRF, I kind of view as like PRP's like glow up, and it has to do with how you process it. So with PRP, you have to add additives so that when they kind of clump. And so that way, when you spin it down and collect the goodness that kind of comes out of the blood and you can get rid of the waste, the water, the plasma, etc., you're left with, like you said, that liquid gold. PRF is a different way in which you process it. And it actually has been shown to have a higher level of those growth factors. So you take it the same way, get the blood, spin it down, etc. But different companies and different surgeons have their own techniques to harness the PRF versus PRP.
And the PRF, it almost feels like a little bit thicker. It's more like jelly-like versus the serum of like a PRP, and then a little bit of thickness of like fat grafting. So they're all different textures. They all look different, but they do kind of different things.
Yeah, exactly. Like a Venn diagram, kind of like some overlapping areas. That's a perfect way. And the texture thing is a great little nugget for everybody.
What would you say are like the best benefits of nano fat grafting? Does it, for example, if I were to have some nano fat grafting like all over my face, what would it do for me?
Yeah. I mean, one is that it comes from you, right? So we talked about kind of some of the puffiness and limitations of fillers and all of that. So one, it's your own stem cells. People oftentimes get really impassioned about that. It kind of makes more intuitive sense if it came from your body, less of an immune response. You know, it kind of just feels more natural. The benefit would be improved collagen formation. So with collagen, you'd see less wrinkles. Think of like those fine crepey crow's feet, or like maybe early wrinkles around the eyes. We also see some increase in the thickness of the skin. So volume, right? Not volume in the sense of like fat grafting where you're placing deposits of fat, but just kind of that like plushness and thickness. If you look at 20-year-olds, they just kind of intuitively, you see that their skin is a little bit thicker than at 60. And we know this is true because of the aging process. So you see increased thickness, that like texture, that bounce back, and some of that glow that comes from increased collagen. So we've talked a lot around the eyes. I also love to use it in those like barcodes above the lips, right? Everybody hates those. We used to call them smokers' lines, but thankfully less people are smoking, and even people who have never smoked get them.
Maybe straw lines.
Straw lines, that's cute. I like straw lines. And tech neck too, right? We're all looking down at our phones. So like those horizontal lines in the neck, those are great areas of use too.
Perfect. So once you get it done, how long is the recovery?
Yeah. So with the actual injection site, I like to compare it to how deep are we going? If I'm injecting it in fine lines and wrinkles and using like a really small needle, it'd be about the recovery of the injection site like you would think of a Botox needle, right? Maybe a tiny little prick. They wipe it off with a little alcohol at the end of the case. Signs of that are gone. You may have just like a little bit of swollen in the area if we're going a little bit deeper, injecting it in that more mid-dermis. And so kind of think of it of how invasive was it to put it in? And that will clue you to what the recovery time is like when thinking about your face. So we talked about you can inject nano fat in the skin. You can also use cannulas and kind of layer it in. You can microneedle it in, right? Just like you do with PRP. And if that's the case, the downtime is going to be the same as the microneedling, not really the fat. You can also, to apply it topically with lasers. So again, you choose your downtime based on the way that you got it into the skin. For the donor site, because that's, I'd say one of the biggest drawbacks is that it does require it borrowing from somewhere else, right? But like I said, there's no free lunch. We got to pay for it somehow. And that is more dependent on how much we take, right? If you need more volume, may have to take a little bit more. And there's just like the risk of bruising. The little incision site closes with just a dissolvable stitch, so you don't need to worry about that. It's just like a little needle, entry point. So maybe a little bruising, a little bit of swelling, but we tend to take it in areas that you can hide pretty well. Lower belly, inner thigh, outer thigh, things that are going to generally be covered.
Nice. And what are some common complications that somebody who has fat grafting to the face could see?
Absolutely. So this kind of gets onto different principles that we have. If we're doing traditional fat grafting, and I do just kind of want to bring in the whole umbrella, bring it back since we talked about facial rejuvenation, and we mentioned that some of that is putting fat back in the face where we've lost it. Always, 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 anytime someone's touching your face, there's a risk of bruising, swelling, infection, and a little bit discomfort, right? We're pretty blessed in the face that generally pain doesn't really come to play. And in fact, I usually tell my patients, if they're hurting, I need to know, because that's usually, on the rarer side of complications. Yeah, because all those little nerves and stuff are not disrupted, or, they're transected so that they have to grow and find their friend on the other side. So we're blessed with a lot of numbness, like when we think of a facelift or a rhinoplasty and all of that. So that's why I tell them, if you're hurting, call me, because that's not really what I'm expecting. So we talk about kind of the generalities. Then to get into the specifics of fat grafting, it's technically a free graft, right? We took the cells and we're putting them somewhere new. So if it's the big clumps of fat to volumize the face, they need to grow their blood supply. And we know that depends on nutrition status and age. So there's a little bit of fat loss. So if I put 2 cc's of fat in your cheeks, someone who's a really, really young, healthy marathoner with a really high metabolism, they may metabolize all that fat before it can get to grow a blood supply. Each surgeon will tell you a different range of what gets absorbed, but generally I kind of like to quote around 20 to 30% fat will resorb. So what does that mean? It kind of means that one of the quote unquote complications is a little touch-up procedure. If you're in love with how much fat we put in, but then a little bit resorbed, sometimes going back later and just topping it off, that fat will then stabilize because it kind of already had a chance to grow its blood supply. The other complication that potentially could come into play with traditional fat grafting would be like lumpiness, right? That maybe we would need massage or maybe even to have like a little bit of micro liposuction. And that's really technique dependent. And so obviously talking to your surgeon and having them describe in detail how they will use the fat will help you feel good about that. Nano fat, luckily, there really isn't the same risks of fat grafting in that sense of traditional, because it's almost more like you mentioned, that liquid gold of a PRP, PRF. The worst quote unquote complication would be like maybe you were hoping for a knockout improvement in the skin and you got a really great one. And you need, again, just to go back, just kind of like with microneedling and the other stuff. What are we hoping to achieve?
I love that. So, okay. Now we know that bringing volume back into the face helps keep us looking youthful. The second thing that you mentioned was the skin. So I have it here like in big black letters, talk about the importance of skincare for a youthful face. So
I love it. Skincare is everything. And luckily there's so many good product lines and things that you can do for your skin at every price point. And so many really, really great dermatologists who have built their entire social media presence about educating on skincare. So just getting on there and getting it from the source from a board certified dermatologist and plastic surgeon is just the best. But it boils down to what can you do reasonably and major on the majors. Focus on what you can reasonably do. Number one across the game is going to be sunscreen. If you can wear a sunscreen and prevent the changes that are going to cause you to age, it's the biggest bang for your buck you'll ever achieve in your entire life. So sunscreen is end all be all. And again, they have that at all price points, right? You can walk into Target and get a great sunscreen. Or if you kind of like that zhuzh and the packaging and the fragrance, they make some really, really lovely ones in that camp too. So sunscreen. Then the second thing I would layer in would be like a retin-A, right? Or retinoid, some derivative of tret that we know from long longitudinal studies helps with collagen production and staving off anti-aging. So those are kind of like
this one's the secret. This one's the secret one not the secret, but this one's the getting on a retin-A or retinol or tretinoin. That's the secret sauce, y'all.
That's it. Absolutely. And it's just going to make everything you do look so much better because you're going to have that, just like we talked about, that young skin glow. That's really, really hard to replicate with other means. Just keep it while you got it.
Keep it while you got it. And my thoughts on it is let's try to do everything before I get there. So taking care of my skin. I have some appointments scheduled for some microneedling, a little bit of broadband light treatments, the BBL treatments. It's called BBL, but it's not the BBL that y'all know. It's a different,
right?
It's a little bit different. So I think for me, that is how I'm going to tackle my aging concerns. I'm going to go with the non-surgical, skincare, laser treatments, and try to get it as tight as I can until I'm ready for my facelift.
Exactly. Same. That's what I'm out here doing too.
You're I'm just trying to maintain what I got.
But until it's facelift time. Because heck yeah, I'm going to do it. I was looking at a before and after picture of a facelift and I was like, I'm going to get a facelift one day. I know I am. I know, same.
I know I am. So thank you so much for coming on the show today. I think you gave us so much just awesome, juicy information for our listeners. One last thing I want to mention, or I want to ask for your opinion on, is after a face procedure like a facelift, a neck lift, or anything on their face, do you recommend lymphatic massages?
I do. Yeah. So I think that there's a lot lacking and a lot of areas of improvement in that post-surgical time that we could actually gain from in the face when looking at what people who are really good at body surgery implement and do. So I am a big believer in lymphatic massage and like things like gua sha and all those, because intuitively it just makes sense. We know during surgery, we had to make cuts, right? And lift and put the tissue back up in a new place. So those lymphatic channels have to grow and connect with their little friends on the other side. And while that's happening, there's going to be a period where your body just doesn't keep up as much with that lymphatic fluid. So doing lymphatic massage would help while those channels are recannulating and kind of getting back up to speed. So I love it.
Okay.
Try to use it as much as I can.
Good. That's what I love to hear. I love getting all the surgeons that come on. I like getting their opinion because, as you know, there's such a wide range of opinions. Mm-hmm. So I like for our listeners to hear what everybody thinks. Are they saying, let's do it? Are they saying, hold off? So I'm happy to hear that you do recommend it for your patients in their recovery journey.
Of course. Yeah. And it's that balance, right? Like there's some of my patients that they're like the go-getters, they're chomping at the bit. Like we took the last stitches out and they're like, 10 days after surgery and they're like, okay, great. When can I start my massage? And then for them, you kind of have to be like, whoa. These things are still healing. We're still very fresh, but that duo is in kind of balancing. Okay, when do we go? So I start people, pretty much as soon as they can, and everyone's a little bit different. Maybe, a month, 6 weeks after surgery, we're doing it.
Okay. I love to hear that. So for all our listeners who want to come see you for either a facelift or fat grafting, any of the procedures that you offer, where can they find you?
Yeah. So, you mentioned I'm from Tennessee. I'm located here in Nashville. Really easy to get to from all areas of the country. Check me out and kind of see what our practice is about. My website is harmonysurgery.com, short for our name, Harmony Facial Plastic Surgery. But usually on social media and all of that, I'm just using my name. And it's kind of same everywhere you go. Instagram, TikTok, everywhere. It's just Dr. Kate O'Conner. Kept it real simple.
Nice. And we'll include your tags in the description. Yeah. We'll link your website and your Instagram. You guys go check her out. I love the results that she's giving. I've heard from patients that she gives amazing natural results. And y'all know that's exactly what I want for y'all. And with that, we end the episode and I'll see y'all next week. Thank you so much for coming on the show.
Thank you so much, Nadia. It was an absolute delight talking to you.
Thank you. We'll see you. Bye.
Bye.
If you enjoyed this episode, please go on Apple, write me a review. It's the best way for other women who are just like you, who need help, who are looking for information, valuable information on the internet. This is how they're going to find it. So go on Apple, give me a 5-star review if you love this podcast. If you want to support the podcast, the best way to support the podcast is through the website. If you need help through your journey, if you need help finding a surgeon, if you want to join the membership, if you're looking for Bruise Juice, you guys don't sleep on Bruise Juice. Y'all know I have my Bruise Juice 30 coupon code for y'all to use if you're having a BBL, if you're having liposuction, if you're having a tummy tuck, if you need to be using Bruise Juice all over your body. Stop using those other brands that are not tailored for your post-op recovery. Bruise Juice is formulated for your recovery. It's amazing. It nourishes your skin. It helps your fat transfer live. Don't sleep on Bruise Juice. Bruise Juice 30 is the code.
And don't forget, new episodes every Monday. I'll see you then.